Dr. Greene is here today to float teeth. And this is Dakota. And he's going to get his teeth done. And this is our movie star. She was on TV this morning.
Live TV.
You're the assistant?
Yes. Yeah.
What's your name?
Sophie.
Oh, Sophie.
Like, wow.
That helps getting out of there.
He's a good boy.
He's so fidgety. That's why I haven't been able to look at his tattoo.
So we've got some changes going on here. We see the bulginess under the root here.
Yeah.
So Dr. Greene is getting ready to sedate Dakota for his teeth floating procedure. And I've never seen this before. And he's being very gracious and letting me video him and ask stupid questions.
Philosophy, the only stupid question is the one unasked.
Oh, that's good. I like that.
Hi, bud. Hi.
Checking the heart rate. So this is just like a conscious sedation, like if
Yeah.
he was going to get like a colonoscopy or whatever.
Just have really good dreams.
Yeah.
But he can still stand. But then his head is supported by that. Know how much to give him to sedate him by his weight?
Yeah, weight and age both play a role. The older horses, I'll reduce their dose a little bit just because of their age. They get pretty wobbly. They don't like to lay down under sedation. They're already compromised in their natural defense mechanism of flight. And so they don't want to lay down. They want to stay up.
He looks like he's starting to feel a little drowsy.
You see the head starting to drop.
He's such a good boy. Okay, so what's his contraption?
This is oral speculum. So it holds his mouth open while I'm working in there so he's not biting on my instruments. Instrument that was developed probably 150 years ago. All of the procedures that I do on these patients, or at least the ones I'm doing today, have been described in the veterinary literature, literally for over 150 years. We developed some new instruments and techniques to make it a little easier on me physically and on them, which is where the motorized instruments came into play.
So floating teeth is basically filing them down, and is that right?
Yeah, the term float means to level. People float concrete, they're leveling it off, and it's been done for a long time. There's skulls from over 2,000 years ago that show evidence of the tooth being filed.
Wow,
So
that's cool. And just coincidentally, my husband happens to be a dentist. And
he is a dentist.
and I don't know anything about horse dentistry, so this is super exciting to me.
Yeah, it's cool. We have the same kind of teeth as dogs and cats. Horses have a different kind of tooth. Since most all hays, grasses, and grains contain biologic silica, which is a very abrasive mineral, horses wear their teeth out in the normal act of chewing. So Mother Nature's solution was to give them a very long, reserved tooth crown in the socket, and as the teeth wear, they continue to erupt. So the term horses' teeth grow throughout their lifetime. It's a bit of a misnomer. The tooth is fully grown by the time the horse is 5 or 6 years old, but it continues to erupt as it wears. So very dynamic process in their mouth as compared to ours. Once our permanents are in, that's all the teeth we have. And for a consistent crown height from the first to the 6th cheek tooth. So those are pretty traumatic. And you can come over here, come behind me. So these are big hooks on the first upper tooth. This is kind of the normal tooth crown here, so the tooth starts getting short on the back of the second, all of the third, and then the 4th tooth is pretty normal crown height, but we've got a very high ridge on the 5th. Any place the upper teeth are short, the lower teeth will be tall and vice versa. So you can see this tall tooth that starts developing on the 2nd all the way through the 3rd, kind of a ramp, if you will.
Yeah.
And then he's got a pretty good ramp on his last upper, I'm sorry. Not real traumatic sharp points, so somebody might have been working on him, just not fixing
It's okay, Dakota. Hold still, buddy.
Again, big hook here, pretty normal crown height in there, shallow through the second, third, part of the fourth, high on the fifth. Here's our tall lower teeth that we'll pull down, and then a big ramp on the last lower. The tooth is also very flat, so this amount that I can make much better today. And
Or an A.
could be an A. I'm trying to see, that's not really pigment there. It's old.
Good job, buddy.
Yeah,
Nice
So
sorry,
are
dude.
only thoroughbreds tattooed there?
Yeah.
Yeah?
Yeah.
Okay.
So standard breds get hot brand.
They don't have any nerves? They don't
They
need
don't.
an anesthesia?
They don't. The nerves are deep in the roots, so they feel the vibration, but no sensitivity that we would get.
Okay.
Which is why we don't have to do the regional nerve
Okay.
blocks on them.
Some serious dust coming out of there.
And there's a slight gap in between the chewing surface.
Oh, wow. Look at that tool. Oh, my goodness.
Good. All of this work was done with hand files for hundreds of years. And so we developed new instruments, so you're not doing this all day. And that was one of the first instruments we developed back in the early mid-90s.
He's all done?
No, got to
Oh.
do his front teeth. So
Oh.
his cheek teeth are all done.
Almost done, buddy. Almost. You're such a good boy. What a good boy.
What do you think, buddy?
He says, I've had better days, but I'm kind of high, so it's okay.
Oh, buddy.
It may quit a little bit after we do
It
them.
has been, yeah.
Because I've smoothed down so many teeth
Okay.
doing the reductions. Don't be alarmed.
What is
Make a
that?
note. Quitting is where they spit out partially chewed hay balls that they're not comfortable swallowing.
Okay. He looks like he's smiling. It's so cute.
Canines.
They were huge.
So the canine teeth, which I'm about to reduce, have a singular function in the horse, and that's weapons. Our domestic geldings and stallions don't need weapons, but they can get very long and sharp. And they can, when I go in and work on the front teeth, my hand's in this space. So I like to reduce them first and round them up. Again, obviously no nerves in that tooth.
That's just like cutting off the tip?
Boy, you're fine.
I know, buddy.
He feels a little bit. You're fine. You're fine, brother. You're fine. You're fine. The prepuce, penis.
Oh, okay.
And around the urethra is a little like a canal or a moat, and it can collect smegma, which is this waxy secretion that produce. So it's a male empathy thing I've got going with my geldings and stallions. I'm here, they tend to be, their penis tends to be relaxed when they're sedated. I'm gloved
Stuart.
up. So it's a good opportunity to get that smegma around there,
Very
which
cool.
is difficult to do otherwise.
Awesome.
Yeah, it's basically like the circumcision, so you have to pull that back and then get the bead out, which if the bead's really big, it's super uncomfortable and you cannot do them, some of them without sedation.
Wow. It's so interesting.
If it accumulates enough, it can disrupt normal urination. So that's why we
Oh, boy.
splinter in your gum. So
That's no
I
fun.
think it's good to get them out. Yeah.
That's a part of a tooth coming out?
That's a full fragment of probably a baby tooth. Luxator, an elevator.
I know, buddy.
Just getting the gum tissue off of it, loosening it.
It's gonna feel better when it's out, I promise.
He's like, I don't believe you. Better.
That's all.
Wow, amazing. Good job, doctor. Good job, Dakota. Woohoo! That came out of his thing?
Around his urethra.
Whoa.
We could probably
Oh
walk
my
him out.
God, that is disgusting. He's a good boy. Yes, he's a good boy. He says, I just had my teeth done. Yeah, he's a good boy.